It was a difficult case. I felt like we didn't get as much information as maybe we could have from the patient. His answers were short and required a lot of going back over and really kind of like pulling teeth sometimes, but based on the information we got, that's the remedy that we prescribed. So, told him to take 1 dose of the remedy and to just wait 10 days and do nothing, and then we followed up after that. So for acute problems, obviously you would never do that. You would give a lower potency and repeat it more often and follow up, depending on how acute the problem was. Every hour you'd be checking in on the patient, or every 2 or 3 or 4 hours, or certainly every once or twice a day. But in a chronic case, you can give them oftentimes, depending on the situation, but typically it's oftentimes 1 dose and then you'll follow maybe a month later. I don't like to leave someone hanging that long. I know a lot of practitioners will prescribe 1 dose of a remedy and follow up a month later, but for a chronic case, I found that a lot of patients who aren't familiar with homeopathy, most of my patients, it's their first time ever using homeopathy. Oftentimes they're skeptical to begin with. My practice is a little unique because as a chiropractor, oftentimes people will come to me first for chiropractic, and then when I explain to them about homeopathy, they're interested in doing it, but they're still not so sure. And so I do a brief follow-up 10 days after and just get a sense of how sensitive they are to the remedy, how they reacted, and then based on that, I'll tell them just to wait another couple weeks or to take it again, depending on how they are. So I stress to them that in 10 days we don't expect a big change. Basically, what we're looking for is a very general rule of thumb for most chronic conditions. We're looking for like 30 to 50% improvement in that first month. So in 10 days, maybe they're 10% better, maybe they're 20% better, maybe they're not much better yet. But we check in with them to see how they're doing at that point and see if there was an initial aggravation or not, because if there was, then obviously they're not going to need to take the remedy as often. If they didn't notice any change, I might tell them to repeat the remedy, at that point. So he noticed that on the 3rd and 4th day after taking the remedy, he was 30% more irritable and more short-tempered. And that by 10 days after, by the time we followed up, his depression and anxiety was 20% better. His energy was 30% better. But that improvement seemed to fade a little bit as the days went on. The tension in the jaw and the teeth grinding were 40% better. He was using 10% less alcohol, and he cut his Adderall use in half. So the Adderall he would use if he felt like he needed a boost of energy. He didn't notice anything had gotten worse other than a temporary aggravation. And he had a flare-up of some pain in his left shoulder, which he hadn't had before when I asked him. Sometimes an old injury can come back, an old symptom can come back. He said he'd never had it before. Sciatica, which he had before, flared up just for 1 day only. And that was it. So when the remedy is very similar and well chosen, usually a person ideally wouldn't need to repeat it for at least a few weeks. That healing reaction would be triggered, it would keep going and going, and that's a good sign of that you've chosen a really similar remedy. So my assessment was this remedy looked good so far. It might not be the best. It might not be this what we call the simillimum, but it's certainly similar.
Close enough.
And maybe it's a close enough. So on the other hand, though, when someone's under a lot of stress, that can necessitate the need for repeating the remedy more often. And he was with his work. He's between jobs, and he's always stressed about when the next job's coming. And the other factor is all of the drugs that he's using. So, and he's taking that. He's using a lot of drugs. He's varying the dosage day by day, depending on the need, which is the worst. Which impacts the healing reaction more than if he was just taking the same amount every day. So he's using alcohol to medicate, he's using Adderall to medicate, he's using Xanax. So that may indicate that the remedy we gave him may have been the stimulant, and he just needs to repeat it a little more often than someone who wasn't on so much medication. So his assessment was that he had gotten better to some degree, but then he was starting to relapse. Things were getting a little bit worse. He was a little better the first few days than the last few days. So I told him to take another dose, and we would follow up in another like 2-3 weeks. So we followed up again about 2-3 weeks later, and again when he took the remedy he was 20% more irritable this time, so not quite as much, but it was just the first couple days. His depression and anxiety were now 30% better. Is that what he was before? Yeah. Energy 20% better, and sustaining. Tension in the jaw and teeth about the same, which is still 40% better. Still 10% less alcohol use and 10% decrease in Adderall use. So doing well on that. Left shoulder still hurting, which is kind of puzzling, but it's there. And that was it. So it seems like his energy is continuing to improve. He said he felt overall about 30 to 40% better, just generally overall, which is great for, again, still less than a month. And he felt pretty stable. He didn't say he was like starting to fade. So I said, just wait and take the remedy again if you feel like you're starting to relapse. So you've had some improvement, it's kind of stable. I said if you stay stable for more than a week or two, take it again, or if you start to feel like it's starting to drop off, your energy starting to drop down again, take it again. So he took the remedy again a few days later, and the remedy seemed to help again. The initial aggravation was similar to last time, but a bit less. Energy is getting even better. Now he's starting to actually have some days where he's feeling like a burst of energy. And he's feeling more energy when he wakes up in the morning, not as hard to drag himself out of bed. Less Ambien use. Now it used to be 2 or 3 times a week. Now he's only using it once or twice a week. The tension in the jaw and teeth are still better, so now they're much better. They're maybe 60 or 70% better. The last couple nights he had only drank 1 drink only. And the week prior it was about 3 drinks. And before he started treating it was like 5 or 6 drinks. So much better.
It's a huge difference.
Yeah. So, what's great about the homeopathy is as the need for the drugs and medication decreases because the person's doing better, they'll stop using the medications, which will only make the remedy work better, and it also the body starts to get healthier, not just because of the healing reaction, but because there are less toxins, being put into the body. So it's a great positive feedback loop that's starting to impact. So, not only will he be feeling better, but we can save this guy from hopefully having liver damage, down the road.
And save money.
Right.
That's true.
Although the economy needs stimulating, but
Yeah, well,
not in that way.
Yeah.